Why do
All right, crash out about dentistry.
not listen to you? I have been to 2 dentists now. They're so concerned about my receding gums. It is not the issue. I grind my teeth. I understand that. It's been a really bad thing. I have really bad TNJ. I get lockjaw, yada, yada, yada. That's not the issue. I had a cavity up here, back up here. And when I brush my teeth now, I'm feeling it, like there's sensitivity. Like maybe the cavity spread, maybe it got worse. I don't know. But I have been to 2 different dentists and they're so concerned about my receding gums. Like, I know I have receding gums. That is not the issue.
Geez, why don't these dentists just listen to the main problem? Look, that can definitely be frustrating if you go to 2 different providers and both of them are not addressing your needs. But I think it's probably some sort of miscommunication. And this can entirely be the dentist's fault too, even if they're doing the right thing. You see, she's talking about having pain and sensitivity when she's like brushing up on the upper right side. And she said she thinks she has a cavity. Now, a lot of times people come in and they think they have a cavity because they have some sort of pain or something like that. And it turns out there's no cavity. A lot of times cavities don't actually hurt. They don't really hurt until they get really, really big. Now, in that case, it's definitely a big issue. But in her case, it sounds like she knows she grinds her teeth, and grinding your teeth can cause your gums to recede and kind of pull back. And one thing that happens when your gums pull back is it starts exposing the roots of your teeth. Now, the other thing that grinding does is it also promotes abfraction lesions. Abfraction lesions are basically like these punched out lesions right by the gum lines. A lot of times patients think these are cavities because they're like these punched out holes in the teeth, but there's no actual decay, so it's not a cavity. But even if it's not a cavity, it can still be sensitive because that root structure or that dentin is exposed, and that's like a pathway to the nerve. So depending on how it looks, sometimes the only way to fix it is by going to a gum specialist and getting those gums grafted. Sometimes you can like patch it up by doing a filling, or sometimes you can paint some stuff on it to see if that helps. But a lot of times the communication from the dentist to the patient is the real problem, because the dentist sees the problem, they know what's wrong, the patient thinks they're hearing something else because the dentist is talking about the gums, but the patient is talking about their teeth, but really it's the same problem. And I think sometimes even if the dentist, this happens with other medical professions too, even if the provider is right, the way they communicate that to the patient needs a little bit of work.